Hey friends, it's Leah with the Ally Program, and today I'm going to take some time to answer some of your questions. The first one came from a friend in Oregon, and she says, I'm a woman learning intermittent catheterization. I need to cath from the wheelchair, but I'm having a hard time with positioning. Help. This is so very common, and I'm hoping that I can offer some tips and tricks to help you. The first thing that I wanted to suggest is typically with those with female anatomy, it's very common that they don't advance their hips far enough forward onto the edge of their seat. Individuals with female anatomy have to have a very drastic posterior pelvic tilt, almost sitting kind of on their tailbone, in order to have optimal urethral access when cathing from the wheelchair. So a tip that I often give to my friends with female anatomy is you want to scoot to the very edge of your wheelchair seat. If you look between your legs and see any portion of that cushion, you are probably not forward far enough. So you need to advance your hips a bit more forward. At that point, you can then recline back and you should have urethral access. Depending on your strength, your functional skills, your body type, some individuals choose to put one leg onto the commode so they can have better access. Some choose to put both legs on the commode. I've actually had some friends that choose to kind of drape their legs behind their wheelchair casters, and that gives them urethral access. The next question comes from a friend in Texas. They say, my doctor says I need to learn intermittent self-catheterization once my Foley is taken out, but I'm scared it will be painful. Again, this is very, very common and very, very normal. That being said, intermittent catheterization should not be painful. Thinking about how often you're going to have to be cathing, typically it's going to be 4, 5, or 6 times a day, depending on the needs of your bladder, as well as how much liquid you're consuming. Also, caffeine and alcohol can increase the need for catheterization. So, that being said, it should not be painful. If it is painful or if you're having any sort of discomfort, the first thing that I want to know is what is your technique? Are you using ample lubricant and is it the appropriate lubricant for your pH? And lastly, is that catheter too rigid? So often when cathing has the potential to be painful, individuals are more likely to go down a French size. That is the diameter of the catheter. And that's not necessarily going to be the best option. So I consider folks to look at the rigidity of the product and typically go to something that might be silicone or something that is less rigid than, let's say, PVC. This just goes to show there is a time and a place and a product for everyone out there. So it is not always a one-size-fits-all scenario. I encourage you to trial different options and see which product is going to give you the best outcome, as well as maintaining your comfort and overall quality of life. The last question comes from a friend in New York City. They said, I hate waking up in the middle of the night to cath. Between the transfers, cathing, and having to go down the hall to my bathroom, I am wide awake and can't seem to fall asleep afterwards. Any suggestions? Again, this is not an uncommon concern, and some individuals do have to cath in the middle of the night just because of how their bladder responds, just because of how much they've had to drink. And so what I encourage folks to do if they do have to get up in the middle of the night to cath is potentially staying in bed. That way you don't have to worry about the transfer out of bed into the wheelchair. This individual has to go down the hallway to their bathroom. So they're exerting a lot of energy already. Then they're cathing, then they have to go back to their room and transfer back into bed. I for sure would be wide awake as well. So what I would encourage individuals to do is you can get a urinal and you can drain your bladder directly from bed. Set that urinal on the bedside table or on the floor beside your bed, and you can fuss with it in the morning. Some catheters also are attached to a bag, a collection bag, and I have some friends that have a trash can beside their bed. They'll wake up in the night to cath, drain their bladder, and throw it in the wastebasket, and again, worry about it in the morning. Some other strategies that I would suggest are really monitoring your liquid intake, specifically after about 6 to 7 p.m. Thinking about the time that you go to bed and making sure that you are starting to dwindle your liquid consumption around that time. Also, cathing directly before bed and then right as soon as you wake up. So if you go to bed at 11, I would encourage you to cath at about 10:30. That way, when you wake up in the morning between 6:30 or 7, you'll be due to cath again. And hopefully your bladder hasn't become too full or you haven't had any leakage. Again, I would encourage you, if you are having any concerns when it comes to bladder management at nighttime, each individual's story is completely different. So be sure that you are following up with a medical professional regarding the optimal strategy and continue to check back here for additional tips and tricks. Have a fantastic day.